Last week, I found myself in a Facebook group of my colleagues, and the conversation of AI floated up to the top of the feed. And what struck me in this engagement was not only the overwhelming number of people who were sharing an opinion, it is clearly a hot button topic, but the opinion and perspective of some very strong and powerful voices within our industry, in particular within the naturopathic profession, around how we should be approaching AI generally. The argument of some of these most prominent voices went something like this. The environmental impact of AI is massive. The energy consumption is unconscionable. And leveraging these tools is fundamentally incongruent with the philosophy and value system of natural medicine. And while I agree with the opening perspective of that sentence, I want to be really clear about something. I believe that the environmental concern is 100% real, and I want to address that head on. But I also think the conclusion being drawn that we should be, in this person's voice, opting out of AI as a fundamental tool to take a stance is a dangerous level of discourse as it pertains to our ability to reach people, to compete, and to position ourselves in a place where our voice matters. There are a tremendous number of challenges that are currently existing in the landscape of healthcare, environmentalism, AI, and we are living through a time and era where the leadership in the most powerful country on earth is systematically dismantling any capacity towards responsible governance and regulation in incredibly important realms, namely healthcare, AI, and the environment. These issues and the governance issues associated with the technology of AI is of paramount importance. And it requires measured and consistent messaging from important voices. I have watched us in the past as an industry take a stand by opting out. And I think in this particular instance, the danger I feel with that is that no one will care. If the naturopathic profession, or frankly, all functional medicine practitioners, every chiropractor in North America said, I am choosing to opt out of leveraging AI, both in my clinical component of my practice, in my marketing, in my operational, in the operational sense of what it is that I do. If they took that stance, I'm not even sure it would make the front page of the biggest news outlets online or on paper or on Twitter, now known as X. I don't think anyone would care. I think what it would do is it would create a momentary blip for us, and it would render us to a place of permanent irrelevance. AI is not going anywhere, but our ability to regulate it should. AI has tremendous capacity to add to the human experience, but with the lack of effective governance, I believe there are absolutely dangerous consequences. As someone who is a member of the naturopathic community, of the broader healthcare community, as an entrepreneur, I believe in the power of AI to help distribute and disseminate our message. I believe in the power of AI to increase margins in our businesses in a manner that we have never been able to access before. Last year, I sat with 3 colleagues and helped them to put together a plan for their business in the face of their personal bankruptcies because they simply could not manage the overhead of practice any further. I leverage AI and have made a declaration that our company will utilize AI, teach on AI, and deploy AI as a tool and vehicle to assist in the dissemination of our respective systems of medicine. We work with naturopathic doctors, functional medicine, chiropractors, primary care physicians, all of whom are looking for better ways to create efficiency in their practice so they can show up more effectively as clinicians. There are incredible AI tools to assist us in clinical decision making, and there also is a long way for those tools to go. The schools and the institutions that govern our respective systems of medicine need to have a clear understanding of the capacity of AI and the limitations of AI in the deployment of safe care. But that is not an insurmountable task. It simply requires intentionality. And it is not a matter of us saying we need to hit pause on this, that the schools and institutions aren't ready, because this is happening in very real time. As it pertains to the running of our businesses, I think AI presents to us an opportunity we've never had before. The opportunity to expand the margins in our business past the 5 to 8% threshold that is so common in so many clinics. I think it has the ability to take the information that we know and make it accessible to people in a way that we've always talked about wanting to do. We've always talked about wanting to democratize what it is that we know. And these tools are enabling us to do it. And in fact, they're going to do it whether we want them to or not. Having our voices heard in this process is a profound moment of leadership for our industry that I believe we need to rise to, not run away from. In this engagement of my perspective, I haven't introduced myself in the process, and I want to be very clear that it's important to me that I put my name to this sentiment. My name is Dr. Meghan Walker. I'm a naturopathic doctor by background, and I am the founder and chief cheerleader at Clinician Business Labs. I am the co-founder of High Validity, and I am the co-founder of Health Hives. Every bit of work that I have done over the course of my career is a reinforcement of my belief that when people have their health, they can change the world. I am committed to the utilization of technology that helps us reach more people in an ethical and sustainable manner. I don't think that this is the moment to put our head in the sand, but I do think that this is the moment for us to speak up. I do think that this is the moment for us to ask for better regulation, for us to talk about how we offset the environmental degradation that is inevitable with this amount of power use, with the creation of the tools and the microchips required to power AI. And I believe more than ever that our governments need to hear from people who are level headed and intelligent and deeply passionate about humanity, about the need for effective regulation, not just when we want it in one particular area, but across the board to help us set a new standard. I share this perspective as the leader of a series of companies that have very clearly said that we believe that AI is part of the future, that we believe that it will be an important part of how we deliver care. We are utilizing and leveraging AI with a great deal of intentionality and insight and desire as a force for good. And we are equally not unaware or naive to the implications of this technology. But I also believe it is not going anywhere. And so, more than anything, in sharing this perspective, in being truly clear about where we stand, I wanted to speak up and provide an opportunity for us to collectively engage. Not only are we running a series of town halls where we're going to be talking about the disruptive force of AI, we're going to equally be talking about the opportunity. Not only are we going to be talking about other companies who are leveraging this technology, we're going to be sharing how this technology is shaping our own. Again, my desire is to take our respective systems of medicine and put them into the hands of more people. This is a moment for absolute leadership. And it is a moment where we collectively need to be both courageous and decisive. AI is not going to go away because naturopathic doctors or chiropractors or anyone else decide not to use it. The technology is going to continue to be developed, deployed, and scaled, regardless of whether our profession participates. When we opt out, we don't reduce AI's environmental impact by a single kilowatt. What we do is remove our seat at the table. where decisions about AI and healthcare are being made. We're living in an era where we are deregulating tremendous amounts of government oversight at a critical time. Environmental protection, healthcare oversight, technology governance, all of it is being rolled back at once or ignored. As I've shared, AI requires regulation around its environmental impact, around its deployment in healthcare, around its influence on our food supply, our data, our clinical decision making. The people who should be leading that regulatory conversation, the people with deep knowledge of human health, environmental science, systems thinking, value based orientation towards not doing harm, that's us. We need to claim our seat at the table. When we run from this conversation because it's not in alignment with our righteous stance, we disallow and disavow our voices from being leveraged and heard. We are not protecting the environment by opting out. We are just making sure that no one with our perspective is in the room when decisions are made. I want to say this plainly. Again, opting out of AI on environmental grounds, while understandable, is a form of moral luxury. It allows us to feel clean while the world moves ahead without you. And the world needs us as part of this conversation. What I believe AI truly offers our industry and our profession is sustainability and scale. The opportunity AI presents for optimizing our practices is an opportunity to lend sustainability to our entire industry and, frankly, the system at large. Because what we can deploy in a micro level can be replicated at the macro. For the first time, we have tools that can extend the reach of our clinical voices, systems of care, our philosophies of medicine in a way we never thought possible before. A single practitioner with the right AI infrastructure can serve more people more effectively and with less operational drag than a fully staffed clinic could a decade ago. The dissemination and distribution of integrative, functional, and naturopathic perspectives has been limited by scale for decades. We are small and we are underfunded relative to the conventional system. We do not have the institutional infrastructure of hospital systems and insurance companies. But AI presents an unprecedented equalizer. It gives us the ability to distribute our voices, our knowledge, our frameworks at scale that matches the reach of institutions we are trying to influence. Walking away from this is not principled, it's strategically negligent. So, what is the responsible path forward? We're going to have to lean in. We're going to have to advocate. We're going to have to build, and we are going to have to regulate. We need to be among the voices proposing and supporting regulatory frameworks for AI's environmental impact, not standing on the sidelines and not critiquing from a position of non-participation. We need to become curious about and active in leaning into individuals and organizations who are building carbon offset models, proposing energy efficiency standards for AI infrastructure, and developing frameworks for responsible deployment. And as a company, we've made a decision. Clinician Business Labs, High Validity, Health Hives, my own work. We are an AI-first company. We will leverage AI to accelerate and augment the distribution of our respective systems of care and medicine. That means we have to walk a tight line. We have to advocate around the environmental piece and the regulatory piece at the same time as we deploy those tools. And that is not hypocrisy. It is a leadership in an unprecedented era. You can use technology and simultaneously push for better, cleaner, and a more regulated environment because we live in an era of nuance where two things will always be true at the same time. The practitioners I want to platform are the ones who are engaging, not retreating. They are smart, they are value-based people who are doing good work in the world and are willing to bring that intelligence into the AI conversation instead of walking away from it. The world needs our voices right now, and simply opting out all but guarantees our irrelevancy and ultimately, potentially, the extinction of our respective professions, our values, our insights, and our capacity to deliver what I believe is a stronger form of healthcare. The world needs a preventative lens at this moment. It needs us at the table. So, this is not only about a conversation we're going to have about AI. We've made a commitment to lead this conversation within our profession. And this means we're going to keep showing up. We're going to keep sharing perspectives. We're going to listen to opinions and perspectives that are potentially contrarian to our own, because that's what leadership in this moment requires. Not necessarily consensus, but respect for everybody in the room, for the ideas around how we move forward, how we amplify our voices, and how we put our respective systems of medicine into the hands of more people. If this resonates with you, or frankly, if you disagree, I want to hear from you, drop your comment in perspective below. Share this with a colleague. Let's actually have a conversation instead of retreating into our respective corners. Join us for the series of town halls that we'll be running not only in the month of April, if this is when you happen to hit this video, but in an ongoing manner, because things are changing so quickly that we all need to be malleable with respect to our opinions and how we move forward. We're going to share those discussions in a series of town halls that we deliver over the course of the next year. And if you want to be part of this conversation in a deeper, long game sort of way, I want to invite you to join us in our community, opt into our newsletter, attend so many of our free events. All of the information to access all of these different elements is in the description below. We don't get to opt out of the future and then complain that no one listened to us. We need to show up, we need to speak up, and we need to ensure that our respective professions have a seat at the table. I can't wait to see you there.